Hello and welcome to Pregnancy Info. Today we will discuss the causes and treatments of why the female is not getting pregnant after giving the birth of a kid. This situation is called secondary infertility. Secondary infertility is similar to other types of infertilities and shares many of the same signs. However, in this case, you are unable to conceive or carry a baby to full term after having a previous successful pregnancy. Infertility can be caused by either the men or women. Treatment options can include many things that will be discussed in this video, so watch the video till the end. Secondary infertility is the ability to conceive. Secondary infertility is the inability to conceive a child or carry a pregnancy to full term after previously giving birth. Here we will discuss the ratio or how common is it. Secondary infertility is just as common as primary infertility. What are the causes of secondary infertility in the women? It can be traced to either partner or both partners. About 1/3 of cases originate in women and about 1/3 originate in men. In the remaining 1/3, the cause is due to combination of factors or it increased age, complication from a prior pregnancy or surgery, increased weight, medications, STD, impaired sperm productions, alcohol abuse, and smoking are examples of secondary infertility in women and men. Causes of secondary infertility in women include problem in the quantity or quality of eggs. Women are born with a limited supply of eggs and are unable to create new eggs after birth. As women approach their 40s and beyond, the number of eggs left in their ovaries decrease and the remaining eggs have a higher chance of having chromosomal problems. For women where age isn't a concern, there are other reasons that may have a lower number of good quality eggs, including autoimmune or genetic conditions and prior surgery or radiation. Problems with the fallopian tubes. The fallopian tubes, which carry eggs from the ovary to the uterus, can become blocked due to the pelvic infections such as chlamydia or gonorrhea. Problems with the uterus. There are many conditions related to the uterus that can cause secondary infertility. Scarring can occur during dilation and curettage or cesarean delivery that can create adhesions inside the uterus that interfere with future pregnancies. Fibroid or polyps are benign growth inside the uterus that can impair pregnancy. A retained placenta can cause infection and uterine scarring. Endometriosis. Endometriosis is a condition where tissues that normally grows inside the uterus grows anywhere else in the body, such as on the ovaries or bowel surfaces. While endometriosis is common, not all endometriosis causes infertility. Polycystic ovarian syndrome. This is a hormonal disorder characterized by longer than normal or infrequent menstrual periods. A woman with this condition has an excess number of male hormones and the ovaries fail to release egg regularly. Breastfeeding. If a woman feeds her boy only by breastfeeding, her body stops ovulating and releasing eggs from potential fertilization. Weight gain or other lifestyle changes. Weight gain can lead to ovary dysfunction in some parents. Certain diets may affect fertility. Medications may also affect fertility. Now, what are the causes of secondary infertility in men? Causes in men includes reduced testosterone levels. Testosterone plays a key role in sperm production. Testosterone levels can decline due to aging, injury, or urinary or genital organs, or certain medical conditions. These conditions include genital infections, thyroid disease, diabetes, tuberculosis, mumps, smallpox, blood diseases, benign tumors, emotional stress, myocardial infarction, coma, stroke, respiratory failure, congestive heart failure, burns, sepsis, which is potentially life-threatening reaction to infection, surgery in the genital tract, the presence of mycoplasma, which is a type of bacteria, anesthesia. Testicular varicocele. This is an enlargement of veins in the scrotum or the sac of skin encasing the testicles. This condition is a common case where low sperm production and infertility in men. About 30% of infertile men have testicular varicocele. Poor quality semen. Semen is the fluid that carries sperm. After age 40, the quality of semen tends to decline. Prostate enlargement. This can lower sperm count and hinder a normal ejaculation. Prostate removal. The prostate can be removed due to cancer or other conditions. Removal of the prostate can cause semen to flow backward. Late onset hypogonadism. This is a condition where there is a reduction of hormone secretion. Certain drugs that affect sperm count and quality. These drugs include some antibiotics and medications that treat high blood pressure. Sperm quality can be affected by treatment of the following conditions: prostate cancer, enlarged prostate, fungal infection, stomach acid, urinary tract infections, ulcerative colitis, arthritis, gout, pain, cancers, sires, schizophrenia, use of certain commercial sexual lubricants that are toxic to sperm. Non-toxic natural lubricants include peanut, safflower, and vegetable oil, raw egg white, and petroleum jelly. Exposure to certain chemicals. Being exposed to pesticides, lead, industrial chemicals, and excessive heat can impact a man's fertility. Excessive weight gain. This can decrease testosterone levels and increases estrogen level. What are the signs or symptoms of secondary infertility? If a man or woman 35 or younger have had unprotected sex for at least 12 months without getting pregnant, they should suspect secondary infertility. This especially applies to women older than 30 who have experienced pelvic inflammatory disease, painful period, irregular menstrual cycle, or miscarriage, and to men with low sperm count. What should do a couple if they suspect secondary infertility? If you suspect secondary infertility, schedule an exam with the women's health provider, reproductive endocrinologist, or urinologist. Don't delay. Early evaluation is critical to ensure the widest variety of treatment options. What are the treatment options for secondary infertility? Regardless of whether infertility is primary or secondary, treatment are similar and include medications, including clomiphene and letrozole to induce ovulation in women with an ovulatory disorder, intrauterine insemination, which is called IUI, which involves surgically placing sperm inside a woman's uterus to increase the chance of fertilization. Sperm donors can be used in IUI. In vitro fertilization, or IVF, which involves daily injections to stimulate the ovaries, a surgical procedure to retrieve eggs, and egg fertilization in a lab to make embryos, growth of embryos in the lab, and transfer of an embryo into the uterus. Egg or sperm donors can be used in IVF. While not legal in all states of countries, a gestational surrogate women unrelated to the child may be involved in IVF to carry the pregnancy to term. For women without a partner or who desire future fertility, egg freezing can be done before fertilization so that the egg can be stored for future use. Surgery to repair uterine-related problems in women. Doctors can repair structural problems such as removing scar tissues, polyps, and fibroids from the uterus. Surgery to repair testicular varicocele. This condition is the most surgical corrective condition of male infertility. Antioxidants and anti-aging supplements which can increase fertility in men. Drug treatment can also improve semen quality. What is the emotional impact of secondary infertility? Infertility can be a devastating disease with a high emotional toll on individuals and couples. If treatment of secondary infertility fails, couple might suffer from a range of emotions, including anger, sadness, grief, guilt, and loneliness. They might experience a lack of empathy from family members and friends who may tell them they should be thankful to have one child. Unfortunately, even healthcare providers can lack sympathy, which adds to a feeling of isolation. Couple and individual with secondary infertility may need emotional support and may benefit from support groups or a mental health professionals. This is all about the causes and treatment of not getting conceived after first baby birth. Take care.